ਸ਼ੂਗਰ ਦਾ ਕੰਟਰੋਲ ਜਿਹੜਾ ਆਪਾਂ ਸਮਝਦੇ ਹਾਂ ਉਹ ਕਿਵੇਂ ਆਉਂਦਾ ਹੈਗਾ। ਫੂਡ ਤੁਹਾਡਾ ਰਾਈਟ ਵੇ ਡਿਲੀਵਰ ਹੋਏਗਾ ਇਸ ਪੁਆਇੰਟ ਤੇ। ਇਹ ਜਿਹੜਾ ਪੁਆਇੰਟ ਹੈ ਇਟਸ ਅ ਨਿਊ ਪੁਆਇੰਟ। Earlier your food was going into this big pouch and then into the first part of the intestine, and then it would travel all the way down and then it will reach this point. So what happens normally when your food travels through the first part of the intestine, most of the cholesterol and fat and sugars are absorbed. God has designed it like that. The most energetic things should be absorbed first of all, like sugar and fat. So gradually this portion becomes insensitive to sugar. So if you take a lot of sugar, put some sugar in your tea or coffee, or you take some chapatis or bread, which is carbohydrates. So gradually this part of the intestine, which normally should send good signals to the pancreas, it should inform the pancreas that a lot of sugar has come, and accordingly the pancreas will produce insulin. So what happens in type 2 diabetes, it's a simple concept to understand for a layman, although there are 100 different theories behind it, but very simple to understand. This first part of the intestine acts as a sensor. It senses how much sugar you have taken. So accordingly it will send signals to the pancreas. And with time this sensor becomes poor. So sensitivity decreases. It gets desensitized. It's not sending proper signals to the pancreas, and that's how we get sugar. And now your food will be delivered to a new sensor, which we expect that should behave much better because it's a new place. So say if you have taken a lot of sugar in your coffee or tea, it's going to hit this point, and this point will suddenly see high sugar content, which earlier it did not used to see, because by the time food reaches this point, most of the sugar was already gone into the blood. So the contents which reach this part of the intestine normally they don't have high sugar or carbohydrates, but now everything will be delivered right away to this part. So you got a new sensor, and how much this sensor works now, it varies from patient to patient, but generally we have seen it works. And 99% of the patients, they even don't need insulin or even tablets after surgery. But as we already explained to you, this is not to stop the tablets. This surgery is to have a much better control on diabetes, and then this surgery is to push the cholesterol out of your body, the fats out of your body, so that you have less fat in your blood vessels. Less fat would deposit inside your kidneys and the fundus of the eyes and heart, and brain. So it would keep you away from all these metabolic diseases like heart attack, stroke, and blindness because of diabetes, and then kidney failure. So medically it will make you better. And at the same time you will lose some weight, which depends on our designing. Like in your case, we have given you a bigger pouch because you don't have much weight to lose. How was your total weight? Was 100 kilos or 100 kilos? So we cannot be very precise, but maybe you might lose 15 kilos or maybe 20 kilos. Depends on how and what you are eating.